Hello there. My name is Justin Jacobs with Health Plan Markets, and I want to personally thank you very much for taking time today to learn more about Health Plan Markets and how we can help you grow your book of business as a professional health insurance agent. So, without further ado, I'm going to kick this off and open up our presentation for you today. Again, I really want to say thank you for taking the time today to learn about Health Plan Markets. I am Justin Jacobs. I'm the owner and principal agent here at HPM. A little bit about myself, I have been an independent agent for almost 15 years. I have also been a captive agent as well as a sales manager. I have personally enrolled over 1,000 people in both the individual market, in the group insurance market, and also in the Medicare market. So I have experience to help you, but I am not alone. We have an incredible team here at Health Plan Markets, and we have been in business for 7 years. So let me introduce you to the team. And in order to do that, I'd love to show you our short little video where it will give you a little bit more insight on who we are.
How has Health Plan Markets, HPM, helped me to become a better agent? Where can I start?
So from an agent's perspective, the reason that we started HPM, we looked at the market and we realized that there were so many agents out there that weren't getting the services that they needed.
Being a captive agent, it was a great experience, but I feel that becoming an agent with HPM has enhanced my career.
Most agents have to build their own system, and most agents out there, they didn't have a system.
Oftentimes, I think I felt like I was on an island all by myself.
It wasn't the income and flexibility that I was looking for.
So we decided to create something to meet those needs.
HPM has helped me become a better agent because now I have a better network to work with.
The one-on-one training and the tools and things that they offer.
How to keep ourselves organized and on task, training, development, a lot of things for us.
I also have more resources as well.
It's given me a lot of tools, marketing, putting me in the right position to succeed.
You don't get those anywhere else.
But now as an independent agent, it's just a whole new world that's being opened up to me.
So you have to be very organized and you have to have a lot of resources.
Some of the tools and perks that I enjoy of being here is the monthly dinners that we have for the top agents.
Last year we took a wonderful cruise to the Bahamas. That was a great time, again, with some of my colleagues that I worked with.
My cruise last year was fun.
The other perk that I really do enjoy is the CRM. It reminds me every day of a birthday that's coming up so I can call the member or send them a card. The other part that I've really enjoyed is having the team that Justin has here.
The perks I really like, just the environment, the culture is healthy. We have 2 offices that we can go to and get things accomplished and get things done.
You're not just an agent, you're family, you work so closely together.
Here we want to help each other.
You become friends and then friends become family.
Becoming an agent with HPM has enhanced my career. I see a brighter future now at the end.
Someone that's looking for an agency, I would definitely say to them, whether they choose Health Plan Markets or another agency, I would really look for a true partnership, somebody that's going to support you in all sorts of ways and help you train and get to the next level.
Health Plan Markets.
Be independent.
But not on your own.
All right, well, my job is done here. So, all right, so that gives you a little bit of insight on who we are as an agency. And see if I can get this. Here we go. All right. So also on our team is our Senior Vice President of Sales and Marketing, Mr. Sergio Diaz. He is also in charge of helping you grow your book of business. He has over 30 years of experience in Medicare Advantage sales and marketing. He's also worked for a couple of carriers. So if you're in the Florida market, you've probably run into him at one point or another at one of the carrier meetings. We also have our sales manager, Mr. Victor Crumity. Victor's been in the business for quite a while. He's also come from a carrier, so he has a unique perspective on how to help agents grow their book of business from the get-go. Jessica Curtis is your first stop once you decide to onboard with Health Plan Markets. She will be there to hand hold you and walk you through how to become contracted with all the carriers that you are interested in selling. She also ensures that we're all on our best behavior and we have our licenses and our certifications up to date. So that way we don't, become, kicked out of one of the plans just because we didn't get certified. So she's making sure that you have your E&O coverage, your license is up to date, and all your certifications are done. And so she keeps us all in check at the agency. We have our own IT manager, and John, a good friend of mine, helped me start this business, and IT has always been the focal point. We really want to ensure that we're delivering all the technological resources that are available to you because our industry is moving fast. The world's moving fast with technology, and we have to continue to update it and make sure that we deliver the digital tools that really help you succeed in this business and do your job more efficiently. One thing I will say is that if you ever have an issue with electronic application, if you have issues with your email, if you have issues accessing digital resources or web portals, all of those things, we now have somebody internal. So John can address those issues so you're not lost or on the phone for hours and hours, or having to meet someone somewhere to get these issues fixed. So John's a big help for us on the tech side. Tom Ryan is in charge of our training and development. He's there to help coach you and also ensure that you're grasping the knowledge of all the different parts of Medicare and health insurance. So Tom is an awesome resource. You can get him on the phone or a video chat if that's more important to you or easier for you, and he will help develop you into a successful agent. Then we have Cindy. Cindy is our admin and agent support. So you will be assigned to either Cindy or Kim's team, which I will introduce you in just a moment to Kim. And Cindy is outstanding. She's your first greeting at the door when you come into our office in Orlando. But she's also there to check in on you on a weekly basis to see if there's anything we can do to help you and support you when you're out there selling. Same thing with Kim. Kim also has the responsibility of telesales. So if you have a book of business and it's just too large to reach out to them, or you're jammed up and you'd want to focus on selling, Kim can actually set appointments for your clients to meet with you. And she does all that heavy lifting for you. She'll call, set the appointment, put it in your calendar, on your Google Calendar. And so that way, preset appointments, especially helpful during open enrollment. So she has an awesome job there in doing what she does for our agents. Here's our main office here in Orlando. It is a retail center. We do service the local community so they can come in and get their questions answered and enroll in our office there off of West Colonial Drive and Powers Drive, just east of Hiawassee. So we are there to serve you. You can come in Monday through Friday, 9 to 6. We also have a brand new office in Jacksonville that was recently moved over into our brand. We're on the north side of Jacksonville on Dunn Avenue, just south of the airport, about 10-15 minutes from there. Great location and easy access to I-95. So here's our carrier partners. We are contracted with over 24 different health insurance products. And so, we are not lacking for a good portfolio. Now, as you grow in your business, you may not want to start off with all of these companies. And then also some of these companies are exclusively in other areas, in other states, and in other regions. So for instance, HealthNet is there in California and the Southwest versus Clover, which is predominantly in the New Jersey and Northeast United States. Devoted is just in a couple of pockets as well. So, depending on where you are in the world, all or some of these products will be available to you. One thing also is if you hold licenses in other states, we are now contracted in over 15 states Why that's important to you? Well, if one of your clients moves or you're not licensed in a certain state, we can still compensate you for enrolling them while keeping them with the HPM family. So, great opportunity because of the licenses that we have. So let's address one of the biggest issues that face independent agents, and that's feeling lost. When you're independent, you work for yourself. Normally, you don't have a place to go, an office to go to, a manager or a support team. And these are the biggest issues that face independent agents, not to mention growing your book of business and managing your book of business. So let's address some of these issues. And our tagline this year is be independent, but not on your own. So when you join Health Plan Markets, you are not completely on your own. Yes, you do work for yourself. You run your own hours. You have your own business, and you can use as many services that we offer as you'd like, or none of them at all. But we are here to help you. So you are not alone. And so that's why we introduced the team in the beginning, is because you have an entire team behind you to really help you in growing your book of business and managing your book of business, which is most important. So, what's our recipe? At Health Plan Markets, we realize that each agent is at a different point in their career. Whether you've been in this business for 5 minutes or 5 years, we understand that each person is different. Each experience is different. So if you've been in the business for 10 years, obviously we don't have to teach you about Medicare and Medicaid and LIS and how to pick out your special election periods and what to do for marketing. You've probably learned that along the way. But if you're a new agent, that all of that, you're like, wow, where do I start? So we understand that each experience is going to be slightly different. The other thing that sets us apart is our technology. And like I mentioned in the beginning, technology is a focal point, a core value in our company. And we want to ensure that you are trained and have access to the digital resources that we have built and have come into as we have built HPM. So all of those resources are going to be available to you. I would also say part of our recipe is a helpful team culture. Again, you're not on your own. Yes, you work, you're independent, but we're here to help you. And we have like-minded agents, and we share a lot of the secrets and tips and tricks that can really help you grow your book of business. We are results driven, and we look for results driven partnerships with our doctors, with our health plans, and with our marketing sites. So as you join our team, you'll be introduced to some of these relationships, but these relationships are results driven. We're not just going to introduce you to a partner or somebody that's just going to waste your time. We're looking to help them grow your book of business. If you don't win, we don't win. And I would say the last thing, the cherry on top, is appreciation. We live by appreciation, and we show appreciation to our agents in many different ways. Some of the cultural things that you'll experience once you onboard is every Monday morning, we do a shout out to our top agents. We also do a conference call to keep you up to date on what's going on out there in the industry. So that's a huge part of what we do. We also do a top producer dinner every month, outside of pandemic situations and that kind of thing. But we do recognize our top producers on a bi-weekly basis. And every year we take our top producers out to a special trip. Last year we went to Costa Rica. The year before we went on a cruise in the Caribbean. And this year we're doing an escape out to Clearwater Beach for about a week. So we're really excited about those trips. And it all goes back to the appreciation factor at HPM. And again, teamwork is what wins championships. I'm a Miami Dolphins fan, unfortunately. But as you know, with football, there's not one player. Yeah, you can have an all-star out there, but it's all teamwork. Nobody wins championships by themselves. So communication and partnership is really what defines our relationships with our agents, including you. We want to have a working and great relationship. So that way we can help you win business. And that's what it's all about here. So here's a couple of reviews that you can find on our Google page that were recently left. The first one, Tanisha, who we call lovingly Tina. She said, love HPM. I can truly say they are the best agency to work with as an independent agent. They provided me with the trainings and assistance I needed to be a success in the field. Kudos to the entire staff. And then Kelly Harrington. I've been with HPM for 4 years now. I find the staff to be extremely proactive in helping me in all areas of support, and my fellow agents and I are always willing to share best practices and ideas with each other. Thank you, Justin, for showing true and authentic leadership. I appreciate that, Kelly. But he just goes back and shows that, this is all about sharing best practices and ideas, and that's how we all win. So again, it's about teamwork. Some of the things that I'll point out here: yes, we have field support, we have personal coaching, which you met with Tom. We have marketing sites. We have a knowledgeable staff that's trained on a yearly basis. Although some of them are not licensed at our staff, I also require them to do fraud, waste, and abuse training, and then share with them the AHIP so they're up to date on a lot of the industry speak for you. We do have lead programs available for those agents that are actively selling. Our own CRM system, which we will discuss in just a moment. Some great mobile digital tools that will help you sell out in the field quickly. Customized marketing materials. We put your picture, your name, your email, your phone number on it, not HPM's. We market you. Also, direct pay. We set you up when possible, direct pay to you from the carrier, except for 2 instances, and that's with Molina Healthcare and Ambetter, both ACA products, individual products, and they require us to pay you. But we do pay those commissions every 2 weeks, and it is direct deposit on all of that, so you don't have to chase us down for a check. And we are now building out personalized websites for you, so you have your own landing page that you can send your prospects to, and they can enroll right from your website. So we're really excited about that piece of the puzzle. Here's an example of our personal website. As you can see, we put your picture, your name, your phone number, your email address. And this is a great way for you to generate online leads and enrollments. We actually link out to some of the carriers so people can get quotes or do the enrollment entirely by themselves if they feel comfortable doing that. But it's a great way for them to learn a little bit about you before they pick up the phone and call you, or you call them. So it's a great tool that gives people a little bit more confidence in dealing with you out in the field. Brand new, we do now have Connecture. Connecture is the online e-app enrollment system that allows you to enroll multiple carriers on one platform. What's fantastic about this system is it allows you to do a quote, you can compare plans, you can email it, and you can text these links to your customers, to your prospects, and they can do the enrollment remotely through their email or even their phone, which is awesome. If you're doing Medicare Advantage plans, scope of appointments are a mandatory procedure, so you have to send out your scope of appointment for them to sign. This can all be done remotely and through text message, which is really awesome. So it gives you the ability to learn one platform, and you can enroll multiple carriers through this one platform with Connecture. So very expensive system. We have access to it for select carriers. We also have the CRM system, which I'm going to talk about in a moment, but this is how you report your applications and get them into your CRM system. When you report your applications, you're able to build your book of business in a spreadsheet format, but also it automatically gets added to the CRM system. It helps you stay organized. It helps you leverage your relationships with the doctors and the health plans. And then in the fall, when you're ready to send out your letters, your text messages, your emails, your phone calls, it's already pre-formatted, so it's ready to go. You can also see trends out there, who your top doctor is, what marketing sources are working best for you, who your top health plan is. So you're really able to see exactly what's going on with your book of business. And of course, we run contests like our cruises and our trips. All of that is available when you report your applications. So our customer relation management software system, and this is a CRM system. You'll have access to this. It is customized for health plan markets agents, and it really helps manage your day-to-day automatically. So what's really exciting about this is we have recently made this software free for you, and it is expensive to build out, but this gives you the ability to access your clients and all of their information 24 hours a day, 7 days a week. It also gives you reminders for follow-up, also your daily to-do list. So for instance, if you do your 10, 30, 60, 90-day campaign where you follow up on each one of your enrollments for each of those periods, it will pop up on your to-do list. You can also put in your own notes, follow up with Mrs. Jones on Thursday. And then on Thursday, it pops up and says, you need to follow up with Mrs. Jones. So great software system to manage your to-dos. You can also keep notes on all of your clients. And throughout the years, I can tell you that this has been a fantastic tool for me because I don't have the best memory in the world. So if you're out there dealing with your clients, they call you, or if you have an issue, you can notate it in the CRM system and it's all kept under their name. So anytime you pull up their name, you can see all the notes and the last interactions that you've had with them. Also, it's a great CYA. So, he said, she said, you have it documented, when you sent one or when you sent a certain thing. So all of that is documented in the CRM system, which is amazing. And then my favorite part is the automation process. So imagine if you can the system automatically send out birthday cards, thank you cards, AEP reminders, and all those different tools that you have to stop and put these things together, these campaigns together. This is done for you, so you have the ability to set that up and send out those birthday cards, thank you cards, and all the other things that go into keeping a great relationship with your customers and prospects. Our training calendar. So really excited. If you've been in the business for a while, we used to do a lot of live training sessions. Now it's moved more towards online, but there's so many carriers and so many trainings that are going on. Whether you want to learn how to build your business plan or you need to learn how to use a certain e-app system, these trainings are all over the place, from United Healthcare, from Freedom, from WellCare, from Devoted. So you would have to have your own calendar to manage this. We do it for you. So you have one calendar we send to you, and you log into that and you can see exactly all the training sessions from all the carriers all in one place. So it makes it very easy for you to see what you need to train on and what you'd like to do. Very, very excellent system, especially for those that have mandatory trainings. Some of these carriers are doing mandatory trainings, and so we need to make sure that we're there. And so this calendar keeps us organized and up to date so we don't double book ourselves. Our Gold Key. This is one of our unique features that we have at Health Plan Markets. What we've done is we've created an online server that allows you to access all of the PDFs and digital resources for you to sell. So you need to make sure that you have scope of appointments. You need to make sure you have summary of benefits. All of this is saved and archived in a folder and organized for you to access 24 hours a day, 7 days a week. So you'll have things like the formulary, summary of benefits, all the sales videos that each carrier requires you to show your clients before you actually sign them up, extra help documents, marketing guidelines, even the applications are saved in there. If you need to print out a paper application, it's saved in there. So you don't have to jump to each one of the websites and find these digital assets. They're all saved on the cloud for you to access 24 hours a day, 7 days a week. So we're really excited that that is available for all of our agents. So let's talk about some of the opportunities that are available this year. We are moving pretty quickly here in 2021. So we do have seminars and webinars that are going to be available from select carriers. So if you have experience presenting Medicare products, then I would love to hook you up with some seminars and webinars that would be available for select products in the areas. We also have marketing dollars. And again, this is once you start doing some production, we'll have marketing credits that we give you here at HPM that we reinvest. So if you want to do a mailer for your book of business, or if you want to hit a T65 campaign, or you want to do Facebook marketing, all of that is available once we start getting some applications in and going. So we want to reinvest in you and help you grow your book of business. Also, our doctor relationships. We have deep relationships with big groups and individual doctors that need an agent to work with. So we love to assign offices to our agents so that way you can go out there and build a relationship with the office and hopefully generate some leads and help them grow their office as well. I have an entire training on how to work with doctors available that I'll make at your disposal when you're ready. All right, so this is some of the doctor groups that we work with. Most of these are here in Central Florida, but many of them are across the nation. I'll give you an example here. Dedicated Senior Medical Center. They are also known as ChenMed and GenMed, and all of those guys are from here into the Midwest. WellMed is nationwide. I think they're in almost 50 states. Optum the same way, really big doctor groups available to work with, and we have relationships with them to help you grow your book of business and to connect you with a physician to work with. All right, let's talk about money, my favorite part, right? So when you join Health Plan Markets, one of my first goals is to help you hit 6 figures in this business. And what's great about this business right now, individual, family health insurance and Medicare is pretty much at about the $20, $21 amount per member per month on the renewals. So you really only need 393 clients to go out there and to have a 6-figure income, to earn over $100,000 a year. Having 393 enrolled clients on the books at approximately $21, $22 a month, you're receiving over $8,000 a month in residuals and earned income. Now, this is not get rich quick. Those of you that have been in this business for a while, this could take years to build, but I'll tell you, not to sound cliche, but you get out of it what you put into it. So, if you go out there and you do 100 sales this year, you're a third of the way, a fourth of the way there already. And you could really build a book of business. I've seen it done in a year. I've seen it done in 2 years. So it's a process, but we're here to help you and to grow that book of business for you. And again, my goal is to get you to 6 figures. This is really when things start to change for agents, when you don't have to do as much marketing and clients start referring business to you, referring business. And that's what we really teach here, is how to generate client referrals. And this is a big part of it. All right, getting started. So Devoted was the one of the carriers that sponsored our last meeting. So I have their logo up there too. But again, we offer this for all carriers. You'll see in lock-in, we are currently in lock-in, and that is from April 1st until September 30th. October 1st is when Medicare marketing begins. And this is a great time for you to secure your book of business in pre-AEP, which is from October 1st to October 14th, and lock in those new clients. Anyone that you definitely are going to enroll in a specific plan, you can get everything done. You can even do the enrollment. You just can't accept it. So that's there. And then, of course, it's go time, October 15th to December 7th. That's when we turn in all of our applications for January 1st effective. In there also is our ACA timeline, which is from November 1st to December 15th. And that kind of overlaps with what we do with Medicare. So, and then of course, Medicare has a second open enrollment, which we call open enrollment period, from January 1st to March 31st. And that's kind of like your boo-boo or any missed leads or missed opportunities that you have. You can follow up with those folks, and they have one last chance to join a Medicare Advantage plan at that time, if they're on one, or look at their options. So this is a timeline. Right now is the best time to get contracted, certified, and ready to sell. You want to get this stuff done before September if you can, and then move it into the rest of the year. When you go into pre-AEP, you're ready to go. You don't have to worry about certifying. All right, so I have a deal for everyone that is watching this video. If you join now, there should be a form below me or to the side of me where you can fill out to get started. If you join right now, and through this video, we will pay for your AHIP for 2021 and forward. So as you know, AHIP costs approximately $125 for that annual test. But if you join HPM on your first sale, I will reimburse that $125 to you in the form of a check. And that could come now or during AEP or whenever that happens. As soon as I see that first enrollment come through, that check is cut and paid to you. And again, this deal is only for those folks that have made it this far in the video without hanging up on me. All right. Now, if you're ready to go, like I said, you can go ahead and fill out the form that's somewhere around this video here, or I will link it in the description, and you can go ahead and bounce out and fill out that form, and we can get you started. You're going to want to ask for Jessica if you're calling in at our 844 number, or you can wait for our email and we will get you set up. Really hope that you take advantage of this offer, and joinhpm.com is where you can find more. I want to thank you for taking time out of your day to watch this video and hopefully give you a little bit of more insight on what we do here at Health Plan Markets. So again, thank you, and I hope you join our team.